Hi, my name is Eric Allen. I am a PhD candidate in the Department of Sociology at Washington State University. Today, I'll be discussing my paper in Sociology Compass entitled Perceived Discrimination in Health, Paradigms and Prospects. In my paper, I review the research on perceived discrimination in health, and I consider the state of the field by discussing many of the methodological challenges and outlining areas and opportunities that are ripe for further inquiry. First, I want to begin by posing a question to you. When you think of discrimination, what do you think of? What images come to mind? Intuitively, you probably think of someone who is being treated unfairly due to having a particular social status, such as their race or their gender. More broadly, an example would be the gender wage gap, in which women who have similar jobs and qualifications as men are often paid less than men. However, one counterintuitive finding is that discrimination is actually bad for your health, which is normally not how we think about discrimination. In other words, discrimination is not simply a fairness issue, it's also a health issue. There are a number of ways that discrimination leads to poorer health, and I outline two of these primary pathways in more detail in my paper. Let me take a step back now and ask, okay, well, if we know this relationship exists, why should we care? Why study discrimination and its consequences for health? Well, there are two primary reasons I think this area is important. First, as I argue in my paper, discrimination is one social process that contributes to persistent health disparities in the United States. Health disparity simply refers to health differences between people based on their social group memberships, whether that is, again, due to their race, or their sexual orientation, or their gender. Second, discrimination is still prevalent. We often like to think that we live in a free and fair country in which discrimination and inequality are just a thing of the past. However, while discrimination, for example, in the pre-civil rights era was often overt and even legally sanctioned, we can think about separate drinking fountains or restricted voting rights. Discrimination today is often more covert and subtle, thus making it more difficult to detect. Discrimination also continues to persist across multiple contexts and institutions, such as in banking or in the labor market or in our criminal justice system, just to name a few. In fact, despite claims by many that discrimination is decreasing over time, some forms of discrimination have actually not decreased at all in the past 20 years. Therefore, we must not only acknowledge discrimination, but we must address it if we seek to have healthier populations. There are also a number of methodological challenges that researchers must grapple with in order to further understand the distribution, prevalence, and impact of discrimination on health, which I discuss in more detail in my paper. I conclude by positioning the workplace as a unique context to further explore the mechanisms through which the discrimination and health relationship operates. Last, I think this would also be a useful teaching tool for scholars across various disciplines, especially those in sociology who teach courses related to intro to sociology, social inequality, social problems, and especially research methods, as again, my paper discusses many methodological challenges that social science researchers must grapple with. I also think it would be useful for sociology instructors to help develop their students' sociological imaginations, to connect personal troubles with public issues. And also, it would be useful for instructors who broadly just want to increase their students' critical thinking skills, especially when they analyze and interpret social scientific data. Thank you for watching the video. I look forward to hearing of any questions or comments you have as you read my paper. Happy reading!